I'll call this the emergency meeting of the Georgetown County Council to order. We are here today to discuss emergency ordinance 20-20, an emergency ordinance to close public beach accesses in the unincorporated areas of Georgetown County and to close public pier walkways to provide authority to the administrator to enact these measures. Like to have a little discussion about that. I'll start it off. Where we are is Isle of Palms, Sullivan Island, Folly Beach, and Edisto Beach, as well as Hilton Head, said they intend to maintain the entry checkpoints and access restrictions. Their joint statement says there is no evidence from a medical professionals that indicates that the threat of COVID-19 in our region has diminished. South Carolina is still in the acceleration phase, and even with the reduction in growth of new cases could begin to grow quickly if social distancing restrictions are lifted. In Myrtle Beach, the city manager issued an executive order Monday to keep the beaches closed. Public access to the beach and adjacent parking will remain closed until the emergency declaration expires. City council orders a reopening or the emergency order is rescinded. Reopening the economy or the beaches should be gradual and only occur when the rate of new infections has slowed substantially, hospital capacity is sufficient, effective testing is in place, and we're able to effectively trace and quarantine those who are affected or potentially infected. We are not there yet. The Trump administration released a 3-phase plan with specific set of criteria it wants states to meet in order to start reopening. Among the criteria, states should see a 14-day downward trend of positive cases. In South Carolina, this has not happened. The number of cases has plateaued, said Dr. Linda Bell, the lead epidemiologist with the South Carolina Department with DHEC. But DHEC's data does not yet show a downward trajectory in cases. People will continue to be infected and more people will die, she said. Many of McMaster's restrictions, including a stay-at-home order, remain in place. The Trump plan asks states to have a, quote, robust testing program in place for at-risk healthcare workers, including emergency antibody testing. Gaps in testing persist in some parts of our state. The president's guidelines also call for antibody testing, which can determine whether someone has built up a resistance to the virus. The Grand Strand Hospital System, Tidelands Health, does not have antibody tests on hand, said Dr. Gerald Harmon. We have to have more testing available, Harmon said. Myrtle Beach officials say there aren't enough coronavirus testing resources in the area, as health professionals cite the lack of testing could be producing inaccurate data, providing a false sense of security. Myrtle Beach City Council held an emergency meeting with health and epidemiologist experts via conference call to discuss the current state of the respiratory disease as cases continue to rise. On the call, the city's emergency manager, Bruce Arnell, said that while there's been no reported bed shortages in any area hospitals and personal protective equipment remains steady, testing for the coronavirus remains problematic. We do not have adequate testing resources in our area, Arnell said. Debbie Borst, an infectious control nurse for the Myrtle Beach area, added that Horry County also doesn't have drive-through testing available. She issued concern with the absence of adequate testing kits, explaining that it's difficult to know the contagion cycle of the virus if the public isn't getting tested. Dr. Edward Schwartz, Chief Medical Officer with CARE here, advised the city of Myrtle Beach should consider relaxing some restrictions only when they can show there's enough testing supplies, hospital space, and personal protective equipment available in the event of an uptick in confirmed cases. In South Carolina, the number of COVID-19 cases statewide is expected to keep climbing with a peak around May the 2nd. I'm almost through. Myrtle Beach Mayor Brenda Bethune told the Post and Courier, this has to be a very methodical, controlled decision that is based on a lot of information and facts. During an emergency city council meeting Monday morning, Myrtle Beach Police Chief Amy Prock told council members she has already reached out to a number of law enforcement agencies in Florida. And she says the challenges are with enforcement, adding that she's also worried about the risk of exposing her officers to the virus, which has already happened. Bethune confirmed 35 Myrtle Beach police officers are among the nearly 100 city employees in quarantine after they were exposed to the novel coronavirus. I just want us to be very, very careful, because as soon as we say the beach is open, we're going to be welcoming day trippers to come here and college kids and increase our risk of infection when we have made such progress so far, Bethune said. I would hate to see us take a step backward and potentially threaten whatever tourist season we can hope to recover. So that's it. With that as background, I really believe that that we should, I believe the Georgetown County beaches should remain closed, and I'd be happy to hear other council members' thoughts on the matter.
John, this is Raymond. I got a different view, definitely, than what you have. Few things you mentioned, it almost sounded like you could be on the evening news with everything that you read off. But just like the 35 quarantine officers in Myrtle Beach, those were quarantined, not necessarily tested to have the virus. Make sure everybody understood that. The access to the beaches, we're starting to open up the small businesses, especially around the Pawleys Island, Litchfield, Murrells Inlet area. And I've talked to several of the businesses over there, and they're dying a slow death as the way we're doing this thing. I'm in favor of opening the access to the beaches back up, because if you go around town, if you're not going to get the virus at a grocery store or some of the other businesses that are open, I doubt it very likely you're going to get it on a windy beach, where social distancing can still be carried out on the beach. Just like when we closed the boat landings originally, never understood that. Thank God the governor, some of the state senators and all got to the governor, and he decided to open them back up. But I think it's just a bad decision to keep the beaches closed. Myrtle Beach, Isle of Palms, the beaches to the south of us, I have no concern about those whatsoever. I'm just mainly concerned about the businesses and the taxpayers of Georgetown County.
To add to that, if I may, I'm also opposed to keeping them closed. First of all, I am told by Grand Strand Business Alliance that it's likely Orange County is going to vote to open the beaches, not close them. They've been in touch with various council members. Myrtle Beach Council has not yet voted. Their mayor gave direction to keep the barricades up. And Georgetown is meeting as we are meeting currently, and they're going to likely vote to at least keep it open for residents. So some of the closures to the north here, I think, are certainly uncertain right now. So if you go to the DHEC website today, you'll see that, first of all, we have passed the peak in terms of what they project. And secondly, getting back to the beds that John talked about, as of today, 277 beds are needed statewide. 4,679 are available. Of ICU beds, 60 beds are needed today. 404 are available. And the governor is required to follow federal guidelines, and he's required to follow the federal restrictions on what to open and when to open it. He also has free access to DHEC and CDC data, which he's responding to. So I guess I would ask the rhetorical question: if the governor, who's better informed than we are, thinks it's okay to open them, why do we think we know more than the governor does, or the federal government for that matter? And secondly, when it comes to reopen, if we were to close, what basis are we going to use to reopen? When do we decide we have better information or more information with which to open than keep them closed? So just continuing to keep things closed to me seems a little bit arbitrary and capricious. Flea markets can open and are open as of today. Retail stores, and going along with what Raymond said, I think you're more apt to get the coronavirus at a flea market than you are walking around the beach. So my perspective. Further add that this is rumor or speculation, but I think we're going to see some restaurants opening up May 1, so a little less than 2 days away. So again, how long are we going to keep things, the beach closed? I mean, is this a limited period of time, or we keeping it pretty wide open? So my thoughts.
Okay, this is Louis Morant, and I listened to your comments and everything else. It's almost like a balancing approach in some respect. I guess we have to make a decision as to which is more important to us: the health of our citizens or the economy of our economy. It seemed to be it may be a difficult approach in some respect, because I agree with John, really, that the beaches should not be open at this time. From looking at the different perspectives and different reports that I've seen, it's as though that there have been some new cases just found in Myrtle Beach on yesterday, if I'm not mistaken. And when you're talking about opening it here and you're closing it to the south and to the north of us, then those people are going to influx to our beaches, I think. You're going to have vaster congregation on the beaches than you would in grocery stores, because you're constantly moving, whereas you're just sitting around on the beaches, and the congregation is going to be a little larger. The governor has talked about we still have social distancing going on, but who's going to be able to enforce that? Are we going to put our law enforcement officials at risk for contamination by trying to get them to enforce that particular provision? And that's going to be kind of difficult for them to enforce. So it's almost just there for the sake of being here. No one is enforcing basically social distancing, unless of course there's a party or a large congregation going on. But otherwise, social distancing is not being enforced. At least I'm not seeing it being enforced. I'm more for the health of our citizens, and I think until we can get more factors from our medical providers and from the scientists, the beaches should remain closed. So I'm on the side with John, really, that the beaches should remain closed at this particular point for the health of our citizens. I value the health of our citizens more than I value the economy, because without our citizens, there won't be any economy anyway. So that's where I stand on it.
Everett, Lily Jean, you'll have some comments?
Yes, I'll weigh in. My thoughts, number one, I would choose to err on the side of caution and safety for the citizens of Georgetown County. If we're looking at the precedent set by beaches to the south of us and beaches to the north, basically it's this: if you had 5 stores, 4 closed, 1 open, the population will find their way to the beach or facility that is open. And you have people that will be traveling wherever, not to just directed towards surfers or people that are going to beaches, but you will have your influx of public that would come to the area that's open and available. And if we say absolutely no, no means no, but law enforcement in turn would be patrolling the access points to control entry into that area. If you say yes and you have social distancing, you're putting your law enforcement into quote harm's way in essence to enforce whatever enforce is, not ticketing, but warning people of maintaining the proper distance. This morning you had a further clarification on social distancing, and they're showing that even the droplets, where we're talking about 6 feet, actually travel from 9 to sometimes 12 feet. So with face covering, you're basically protecting others against any droplets or any bacterial presence. If you close the public parking lots and people do come to areas where you do have open beaches, you're forcing the traffic that comes within to a community to park on the thoroughfares. Again, forcing law enforcement to be present to either keep the traffic moving and get out of the area. I don't think anyone wants to come down hard on ticketing, and if it goes any further, that we must set a precedent in protecting the people of our county. Anyone coming in from anywhere, Atlanta, New York, any metropolitan area, we don't know what comes into our area, and we at least must take care of the residents of Georgetown County. So I would be in favor of maintaining the closure of the beaches in Georgetown County.
Mr. Chairman, this is Lily Jean. I have concerns about the beach as well. And in this particular issue, I choose to listen to people with knowledge. And when I say people with knowledge, I'm thinking about our scientists, our medical professional people who have more knowledge and understanding than I do. And when we think about the citizens of Georgetown, even though this may be a temporary hardship for businesses, I think we need to look at the long-term goal. And that long-term goal is safety and the health of our people. And I don't think at this time, even though the governor has left it up to us, I think we need to err on the side of caution and that we should keep the beaches closed. What if we do decide to open? It's not going to work, I don't think, if the law enforcement people are not there to enforce it. And if they are using a lot of time checking the people on the beach, what is going to happen to the safety of the other part of the county? So I think at this time that we need to give it a little more time and not open the beaches. I think it needs to be closed at this point to all people, keeping in mind that at the time it's a financial hardship, but it's not just a financial hardship on businesses. Individuals are suffering too. And I know you're thinking, well, the way to get rid of that is to hire people to go to work. But you don't know whether the person you're working with, whether that person has contracted or has that virus. And when you think about a place like Walmart, Walmart is not just a social place. You go there because you need to, out of necessity. So I would hope that council would understand, in spite of the financial strength that it's going to cause, that we would decide unanimously to keep the beaches closed and accept the proposed emergency ordinance 20-20.
Thank you, Ms.
Jonathan, it
Johnson.
sounds like this is Raymond, sounds like everybody's in favor of keeping it closed. Well, why don't we close it for everybody and not just for a select few that happen to live on the beach? Let's just close it totally. Shut it down. No virus will get on our beaches that way.
Ron, did you have a comment?
I do. The concern that I have with Horry County closing, we're going to get an influx coming into our beaches here in Georgetown County. And as Raymond and some of them mentioned, we got our businesses that's there, and they're going to be impacted by this closing of the beach. But I think we have to err on the side of caution that we don't want this virus spreading. And what I'd like to see us do is revisit this, go ahead and close the beaches down, and let's revisit this 2 weeks from now and see how everything's going. Maybe the beaches up in Horry County will get opened back up, and we won't have to worry about those folks coming from Horry County into Georgetown County, because that's going to happen. And so I just think that for now, let's go ahead and kind of bite the bullet on this thing, close the beach, and let's look 2 weeks from now and see what's happening at that point in time. Because we want to get our small business back up and running, and because they're struggling like everybody else. But we've got to think about the health issue, that if we open these beaches and we start getting 18 people with this virus, and worst case they die from it, I don't want that to be sitting on my watch. So that's my input. Let's go ahead and close the beaches, because everybody else has done this as a cautionary precaution. And then a couple of weeks from now, let's all sit down again and evaluate where we're at that point in time. Thank you.
Ron, Horry County may be opening its beaches today, just a correction there, but I did want to comment. I agree with Raven. Let's close it, everybody. I don't want to see a soul on the beach. We're going to close it.
You're coming in broken there, Steve. Didn't quite hear what you said.
I said Horry County may very well be voting to open its beaches today, but
I talked to Connie Gardner last night, Steve, and he's having a meeting with his staff right now, and they will and they're going to discuss closing the beaches, and then they're going to have a council meeting later this afternoon to make a decision. So he seemed to me to be leaning towards closing the beaches when I talked to him last night.
I'm getting different information, obviously, so we'll see. But agree with Raymond on one thing. We should close the beaches to every single one if we're going to close them, not the privileged few.
Mr. Chairman, if we went ahead and we voted now to close our beaches, perhaps that will impact the decision that Horry County will make.
I agree with you. Well, unless someone else has a comment, the ordinance reads, Georgetown County Council hereby directs the closure of public beach accesses in the unincorporated portions of Georgetown County, including adjacent parking lots, and to continue the closure of Merle's Inlet Marsh Walk, Veterans Pier, and Jetty View Walkway. That the term of closure for public beach accesses run contemporaneous with the term of the Georgetown County State of Emergency, which terminates May 15th, 2020, unless rescinded sooner by Georgetown County Council. I move to adopt emergency ordinance 20-20. Is there a second?
This is Lewis, Morant, second.
Second by Mr. Morant. Anyone have any further discussion?
May 15th is quite a ways away. I think we're going to see a lot of other things open before May 15th.
We have a motion and a second. All in favor of adopting emergency ordinance 20-20, please signify by saying aye.
Lily Jean says aye.
Everett, aye.
Lewis,
John Thomas, aye.
Raymond, no.
Steve Goggins, no.
Teresa, did you get a vote from everybody?
Can I confirm what Mr. Charlton's vote was, please?
To close. And I think we need to expand on the thought. I don't think we need to amend the motion, but I would like to see us revisit this within 2 weeks to look at this again, because it's a moving target at this point in time. Because we're kind of depending what Horry County does, and so I don't think I need to put that in the motion, but I just I would like to be added into the ordinance language.
We'll definitely revisit this and monitor it
Mr.
continuously.
Chairman, the discussion period has ended,
Okay,
and we should be in the voting period.
okay. Teresa, did you get a vote from everybody?
Yes, sir. The
And
vote is
so
5-2.
5-2. So the emergency ordinance 20-20 is adopted. Thank you all for your time this morning. Is there a motion to adjourn?
Lily Jean moves for adjournment.
Motion by Ms. Johnson. Is there a second?
Second,
Second by Mr. Carolina. All in favor of adjournment, say aye. Aye.
Aye.
aye.
We are adjourned. Thank you very much.
Thank you.